Oh, sorry, what was that? You wanted to know more about the benefits of doing this treatment? Okay, let's talk about that. Now, this is a treatment called patting for androgenetic alopecia or telogen effluvium. And patting actually refers to the use of sonically powered microneedling for the scalp and has a range of physiological effects that improve the outcomes of androgenetic alopecia or telogen effluvium. Hi and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chung and today we'll be talking about patting for hair loss disorders. So patting for androgenetic alopecia or chronic telogen effluvium actually refers to this technology that was developed in Italy that uses sonic acoustic waves to cause a shock wave under the skin to allow for neurorevascularization, which is a fancy term for meaning forming new blood vessels. And in the context of hair loss, we are using this shock wave technology to allow for better blood flow to the hair follicles to allow for nutrient delivery and for detoxification of toxic buildup of, let's say, dihydrotestosterone molecules which cause miniaturization of hair. This procedure is actually divided into two steps. The first step would be us using a microneedle attached to a sonically activated device that drives the microneedle using the shockwave. And this microneedle is only 0.25 millimeter long. It barely just punctures the surface of the epidermis, the very outer layer of the skin. And what that does is actually a twofold process. One is that it produces a controlled damage to the skin, and that in itself releases some growth factors and cytokines that cause the hair follicle to have this signaling process that lengthens the growth phase of the hair cycle. And two, it creates little micro channels to allow for better penetration of that growth factor gel that we apply to the scalp before we start the procedure. The second part of the process involves us using the same sonically driven microneedle but at a higher depth or higher intensity, and that further improves the blood circulation in the scalp. But what also happens in the second step is we attach a further handpiece tip that causes a light electrical current to flow across those electrodes. And this light electrical current is called Iontophoresis or electroporation. What happens is it opens up little channels in the basement membrane of the skin to allow for the penetration of larger molecules such as growth factors that need a little bit of help getting through the skin. And this is done in conjunction with low-level laser light therapy, which is a proven technology that has been used and FDA approved for many years in the treatment of androgenetic alopecia. So in Terra, we like to do things to help your hair in a holistic fashion. Assay your blood. We will not only send you for tests using things like TrichoPAT to scan the different areas of your scalp to monitor for improvement. We counsel you on your diet and nutrition, aid you with supplementing for better hair outcomes. Consider the use of medication, but when it comes to regenerative treatments, this is the latest in our arsenal that has been introduced to help patients who are averse to pain, because this procedure is considered not to be very painful. It is a little bit of discomfort when it comes to the frontal, more bony areas of the scalp, but the rest of the scalp is a pretty comfortable process. And this multimodal approach targets different pathways of hair loss. So for example, we'll use a medication to target the DHT pathway, which causes microinflammation in the scalp. But in order to get the blood flow to the hair follicles a little bit better, we can use both minoxidil or this shockwave therapy to help to improve the absorption of nutrients into the hair follicles. And with the introduction of signaling molecules such as growth factors that also come together with this treatment, you get treatments of all different pathways of hair loss. So based on the clinical trials that have been done, this treatment is recommended to be done once every 3 weeks for about 6 sessions, so that's a total of 18 weeks before we go into maintenance phase. So by the third session, what patients do observe is that there is a decrease in the rate of hair fall, or hairs stop falling altogether, and then you start seeing improvements in the coverage of the scalp at about the 18-week mark. And we commemorate that by using before and after photography to make sure that you're seeing improvements. And then we go into maintenance mode, which is usually done once every 4 to 6 to 8 weeks depending on your condition, and that also comes with continued monitoring to make sure that these petting treatments are still being efficacious for your hair loss condition. Because this treatment is based off regenerative principles using growth factors as signaling molecules, as well as using shockwave and low-level laser light therapy, it's actually the only all-in-one device for our patients. And we recommend it to patients who are experiencing male or female pattern hair loss that are a bit averse to slightly more painful procedures like Regenera AMT, for example. But this treatment needs to be done in a program whereby you need to come back for repeated visits in order to maintain its efficacy. It's also useful in the context of chronic telogen effluvium while we are correcting other underlying drivers of this heavy shedding condition, such as vitamin D deficiency or iron deficiency. Petting for chronic telogen effluvium has been shown to be effective in increasing the hair count rate over a 18-week span. So if you're interested in using this regenerative technology for your hair loss condition, do feel free to drop any questions you have in the comment section below. And remember to click like and subscribe to our channel for more hair loss and hair related content.